welcome, Dr. Baines. I wanted to talk a little bit about why we are actually doing a lot of these webinars, touching on all these topics that, frankly, that we've been doing for years. So the clinic has been in existence for around 13 years. And of course, my interest in it started way before that. So it's something that really started a really long time ago. And we've seen thousands and thousands of patients did things before it even had the term longevity medicine uh, put to it. And with this comes real experience, not just data driven, but firsthand from what our patients are doing and from ourselves, because most of us practice what we preach. And that really makes a big difference. And the idea for these webinars is that, especially now that the term longevity medicine is being pushed around, everyone claiming to be an expert, it's quite a concern because when you listen to them, it could be a single person's experience or them and their friends or practitioners who've got a few years of experience, and it doesn't really touch where it needs to. It also looks at things like the NHS and their contribution and if it's enough, which in my opinion it's helpful, no doubt, but it's not enough because they are resource short. It's very difficult for the NHS to do all that needs to be done. Not only that, it is quite a specialist subject, something which a lot of people are not aware of. For someone to become a longevity specialist, they cannot just go out there and learn a course. There, no courses exist at this point in time. It's years of experience, it's having an expertise, especially in hormone medicine, in nutrition, in root cause management of disease, in DNA and genetics. All this makes a difference. And to have someone who has the interest to know all of these subjects, who's willing to take time out to study a little bit more, to go to the next step above from being just a hospital doctor or a GP, that's a lot of work, that's a lot of dedication, and that's a lot of passion. And this is where we step in. And so my hope is that these webinars really put this across to people that this is something to learn from. These webinars are meant to be there to teach you, to give you an idea of what to look out for, what to ask for from your GPs, from your nutritionist, or anyone else that you're working with, so that you get an idea from the ground up from what actually happens in the space of a clinic that you can use on a day-to-day basis.